Good afternoon. My name is Tom Wolf, and I'm a member of the Science, Medicine, and Technology Committee, and I'm here to introduce Dr. Bredow. But before doing so, I've been asked to make a few announcements. First, please take out your cell phones now and ensure they are silenced so as not to distract from our presentation. Thank you. Also, we hope you were able to enjoy the coffee outside the classroom. That coffee was roasted this morning in our SMT course called The Science Behind Your Cup of Joe. We thank presenter and HAS member Rob Colton for sharing his coffee roasting skills with us. Also, welcome to the crowd joining via Zoom in the HAS virtual classroom. Special thanks to our course technicians, David Blatt and Nancy Mack, for supporting our hybrid modality. Also, membership renewal for the 2023-2024 calendar year is alive and running. If you have not already renewed, please refer to the weekly HASP happenings, which includes a direct link to the online renewal form. Make sure you select renewing and follow the prompts. Join us for another wonderful year of thought-provoking courses, engaging monthly programs, and exciting trips. You may even meet Amy or Ian in the office after today's session to complete the process in person. But I've done that process myself online, and it is very simple. And finally, don't forget tomorrow, August 1st, is our monthly program entitled How Libraries Continue to Serve, presented by the director and assistant director of the Herrick District Library. Coffee, cookies, and conversation begin at 9 a.m. in the Jack Miller Center, with the program beginning at 9:30. We hope to see you there. Now for the introduction of Dr. Bredow, who this is at least her second presentation. Is that correct? The second? Yes. That she's made, perhaps, and we really appreciate it. Dr. Bredow is an associate professor of psychology and the director of women's and gender studies here at Hope. She earned her MA and PhD in human development and family science at the University of Texas at Austin. In addition to teaching developmental psychology, Dr. Bredow regularly teaches seminars on the psychology of gender and the science of romantic relationships. This class today will examine what is and what isn't known about how gender develops, the incidence and trajectory of gender diversity in childhood, and the management of gender dysphoria in children and adolescents. Dr. Bredow, the floor is yours.
Hello. So great to see everyone. It's funny, it's kind of like when I teach, no one sits, right? Everybody moves towards the back of the room, but let's like church hall. Yeah, I won't take it personally. So thank you for the introduction, Tom. So as said, I'm Dr. Carrie Bredow. I teach at Hope. And this is an interesting topic to teach on because it's not actually what I would say my area of expertise is per se. So I actually do research on romantic relationships. So that's like my area of scholarship. But I do a lot of teaching and engagement, right? Talking about the development of gender in my developmental psychology classes. I talk about gender absolutely a lot in psychology of gender. And this is a topic that I've talked about in the context of leading, kind of co-facilitating a sex, gender, and sexuality dialogue group among faculty and staff at Hope. So it's something that I've engaged with a decent amount. That said, when Tom asked me if I'd be interested in doing a talk on kind of gender diversity in kids, my first thought was like, oh, that sounds like walking into a minefield. Like, yeah. But, right, I think the fact that this has become so hopelessly polarized and politicized, right, in the last few years is exactly why we have to have these sort of things, right, and dig in and see, what do we know? What do we not know, right? What are the questions that remain? And really trying to understand what is in reality an extremely complex question. And so when we look at kind of the narratives that tend to be put across, they tend to be very straightforward. Like, this is what you should do. That's what you should do. This is right. This is wrong. In reality, the psychology of gender and the science of gender are a lot more complex than any sort of political narrative is going to kind of lay out. And so my hope is really just to kind of give a fairly comprehensive overview of kind of what we know and what we don't about kind of what gender is, how it develops in kids in particular. What is gender dysphoria? How do we define that? What does that look like? And importantly, kind of what do we know about the trajectories of this in kids and adolescents, about treatment and all of that. So I am really pulling from a variety of disciplines in doing this. So although my own disciplinary training is in psychology, if you look at the research on gender, right, and on transgender identity, it's covering a wide variety of fields, right? We've got psychology, but we've got sociology, we've got medicine and endocrinology, right? And so obviously I will not be able to cover every single little tiny detail. There's a lot kind of involved in this, but I'm hoping that you can at least leave with kind of a good overview of what are some of the big issues and things that people are currently talking about in the kind of scientific literature and elsewhere. So my hope is to leave plenty of time at the end for questions. In full disclosure, this is the first time I have given this talk. So you are my unwitting, without knowing it, my guinea pigs. And I am notoriously bad at knowing how long something is going to take me until I've given the talk like 2 or 3 times. So if I'm going to try to time this well, right? Hopefully I won't have to rush through things at the end, but thank you in advance for your grace if I have to steer gear a little at the end to make sure we have time for questions. So labeled the first one Gender Wars 3.0, right? The 3.0 is rather arbitrary. We could pick any number, right? But even if you are a very casual observer of culture, right, you'll know that gender is often, right, at the center of a lot of our disagreements and our controversies. This evolves over time, right? It doesn't always look the same, right? It can switch from kind of one hot topic issue to another. And if you even remotely watch the news, right, or pay attention to things kind of going on, you'll know that kind of right now, right, the hot button issue seems to be transgender identity. That is not to say that no one was ever talking about this before the last couple of years, but we have seen a kind of massive shift in this becoming, right, kind of at the center of political wars, of cultural wars, in a way that it really just wasn't historically. And so we see that, right, you can get this really within the last 2 to 3 years, moving kind of from the periphery, right? People would talk about these things, they debate these things, to being very central to, right, the kind of quote unquote gender wars. So you can see this in different ways. Now it's not going to work, is it? Let's see here. There we go. So one of the ways that this may be most apparent is just looking at what's happening in the political sphere. So if you look, right, and this is just going back like 8 or so years, but if you look before that, it's fairly consistent, right, to the early or kind of mid 2015s. And you see, it's not that nobody was talking about these things. There were different bills being proposed and whatnot, but it's really not until about 2 to 3 years ago that we see this explosion of kind of bills that are looking to, right, put various kind of restrictions in terms of kind of transgender rights, transgender care, a variety of things along those lines. This chart here, actually, 2023, this is only as of April 17th. So if you, as of last week, the number of bills proposed, not necessarily passed, but proposed, right, in different states is 563. And it's only July. Almost August, but only July. So clearly this is something that has gained a ton of attention and has become a very politicized issue. We do see, right, if you kind of look at like, where is this happening? There are some states and regions where it is kind of more prominent, but it's not just a regional thing, right? We see that although some places, right, Texas, Alabama, Florida might be getting more news attention for various bills proposed and passed, right? We do see that a majority of states have proposed, right, at least some bills regarding kind of transgender rights. And a number of them, right, about 20 or so have enacted those bills so far, and many others are still being considered. So this is not just a kind of a localized phenomena that is occurring. So if we look at what are these bills about, right? What is it that is being proposed? They cover a wide number of domains, but one of the things that you will notice kind of looking at it is that they do tend to be disproportionately focused on transgender youth, right? So although there are some things that address adults, most of the bills are addressing things like youth sports, are addressing how youth should be treated in schools, what access to various bathrooms and facilities they have. And particularly within the last year, this idea of whether youth should be allowed to access what is oftentimes kind of called gender affirming care, right? And so when we're talking about gender affirming care, we're really talking about any kind of care, kind of social or medical, that is affirming the gender identity of the transgender child. And so we see that particularly within the last year, there has been a very strong focus on various bills that have been proposed to ban this kind of a care in children. Some have passed, some haven't. But if you look at, right, this, it's really created this very interesting polarized narratives, right, where individuals who maybe had never thought about gender affirming care or even heard of the term, right, 3 years ago, all of a sudden have really strong opinions on it, right? And so this is just an example here. If you look at kind of from April 2021 to March 2023, right? So about 2-year period, we see this shift from, right, not only more people opposing, right, but more people who really had no opinion whatsoever, right, choosing a side. And although you can't see it in this, it actually is lining up much more with political leanings, right? So a few years ago, political leanings were slightly associated, right, with people's thoughts about these kind of things, but not nearly. And then all of a sudden it becomes a political issue, right? And now we're jumping into our political silos. And so, as is happening with many different things, right, in our kind of very politically polarized culture and era, right, we see that there's basically these two dominant narratives that are going on, right? On the one side, you have people advocating that providing care, right, particularly medical care to transgender children is essentially equivalent to child bodily mutilation, right? That this is essentially child abuse and should be criminalized as such. On the flip side, right, you have people saying that denying transgender kids this care is equivalent to a death sentence, right? That by not allowing children, right, to be able to access the care that they need, that this essentially is going to lead to higher suicide rates, all that sort of things, right? And is putting kids' lives in jeopardy. So which is it, right? If we look at this, right, is care such as puberty blockers and kind of cross-gender hormones is that a kind of age-appropriate medically necessary care, right, that saves kids' lives, right? Or are these, right, a kind of form of medical malpractice, right? That kind of, socially manipulated children need to be protected from. As of right now, which answer you think probably corresponds to your political leanings, right? But what we see, and the question is, which side, if either, is actually correct here? So this is a big question, right? And before we can really even dive into what we know about kind of what the research says about these things, we have to kind of look at, right, what are we even talking about when we talk about gender? Because these are also terms that we tend to throw around, right? And oftentimes the way that we use them colloquially, right, in everyday speech is not necessarily the same way that researchers, right, or people who are looking at this are using the terms. And so one way that I always like to talk about gender, and I use it in my classroom because I think it's cute, is the genderbread person. So the genderbread person is basically just getting at this idea that when we talk about gender, there's actually a lot of related constructs, right, that we might use interchangeably, but actually refer to somewhat different things. So although they might be correlated, they're not actually the same. So one of the maybe more straightforward aspects of the genderbread person, right, would be when we're talking about sex, right? So biological sex, this is going to be referring to those kind of objectively measurable genes, hormones, right? Kind of chromosome patterns, things like that, that a person possesses at birth. So generally speaking, sex is fairly easily identified at birth. There are, of course, instances, right, where people may have combinations, right, of male and female, kind of, whether it be chromosomes, various kind of genitalia, things like that, right? But either way, it's something that you are born with. And so when we're talking about sex, it's those kind of biological aspects, right, that are making someone male or female. Gender, on the other hand, right, is often referring to more the kind of cultural, social aspects of things. So gender is oftentimes in research on gender going to be divided into gender identity and gender expression, right? So gender identity, you can see, is like in the brain of our genderbread person here, right? And it's really just referring to how someone sees themselves, right? So do I kind of internally feel like a boy or a girl? Do I feel like a man or a woman? How do I see myself as kind of lining up with, or maybe not, right, the options for gender that I see in my particular culture? And so this is something that is considered internal. Gender expression, on the other hand, is really going to be the more outward kind of portrayal of this, right? So gender expression is talking about, right, how you present your gender through the way you talk, you dress, right, you act, your interests, all those types of things, and how it's interpreted by other people, right? Whether they interpret this as kind of masculine or feminine. And of course, with most people, right, this is probably the one that's going to be the most fluid, right? So individuals, right, regardless of their gender identity, can behave more masculine some days, can behave more feminine other days, right? They may have overall tendencies, but, right, we see that these things can be variable. Even just what you're wearing on a particular day, right, can change, and that's part of your kind of gender expression. So those are kind of the two big aspects of gender that we're talking about. Sexual orientation and kind of romantic attraction is its whole own thing, right? So we oftentimes kind of gets lumped in here, which is why it's part of our genderbread person, right? But that is not actually gender, right? That is going to be talking about sexual orientation, which is referring to, right, kind of who you are physically, spiritually, romantically, emotionally attracted to. So a couple just other things to clarify before we dive in more. One word, right, that you will hear people talk about fairly frequently, which again, may be something that you aren't familiar with a few years ago, but may have heard now, right, is the idea of cisgender. Okay. When we say cisgender, what is being referred to is when somebody's biological sex, right, corresponds or aligns with their gender identity and often their gender expression as well, right, kind of by default. So an individual, right, and this is true for the vast majority of people, right? The vast majority of people, when they are born, you can identify what their sexual genitalia is, right? And if they're born with the sexual genitalia of a female, they will be kind of assigned, right, as a natal girl. They will be raised, right, and treated as a girl. And almost always they come to see themselves as a girl, right, and to behave accordingly. But of course, right, and obviously the topic of this entire presentation, right, is that that is not always the case, right? And so when we're talking about transgender, really we're just kind of talking about this broader umbrella term that's referring to when the biological sex and identity do not match up, right? And again, the key thing here is identity, not necessarily expression, right? Because again, I can see myself as a woman and still behave very masculinely, right? And that doesn't necessarily mean that my identity is different. So really, when we're talking about transgender, although there might be behaviors that accompany it, it's more about identity than expression per se. So where does gender come from? This is a pretty hard question to answer. In contrast to biological sex, right, where we've got really good biological data that shows exactly how, right, various genes activate various hormonal pathways, right, and various sex organs develop. Psychologists have been really interested, but where does gender come from, right? How do we come to see ourselves as boys and girls, right, or men and women, and to kind of behave accordingly? How does this process kind of develop over time? And one thing that's kind of interesting about gender is that gender tends to be the very earliest social identity that kids develop, right? So we have a number of different identities that we kind of develop over time. Gender, probably because it is so visibly apparent in our culture, right, in our society, and most societies and cultures, right, tends to be the first things that we develop. And so developmental psychologists have really generated a decent amount of research, kind of try to understand, like, how does gender develop over time? What does this look like? And we do see that there tend to be some fairly predictable patterns, right, over the kind of early childhood years in terms of how kids' gender perceptions and behaviors develop. So despite the fact that I've kind of used an arrow on here, right, this is not necessarily a purely linear process, right, in the sense that over time you just become more and more gender typed. What we actually see is more of a kind of moving through phases, right, where the first phase is kind of like general awareness, right, and then we see a phase of really rigidity, right, and then moving into kind of greater flexibility. And so kind of looking at the awareness, if you look at, okay, when are kids aware of gender? Well, at the most basic level, about 6 months. We know that at 6 months, babies can differentiate between male and female faces. By a year, they can match male and female voices to male and female faces. Now, does that mean they have a full understanding of gender? No, but it means they're aware of this as a category that matters in our society. The first kind of stage that developmentalists often look at is this idea of gender identity, is what they refer to it. It means a little bit different than what we refer to as identity, kind of more colloquially, right? But it's basically, at what point do kids start identifying themselves consistently as girls or boys, right? If you ask an 18-month-old, right, they're assuming they're verbal enough to answer the question anyways, right? Generally not going to have a real great idea of a girl, boy, what that means, even though they can differentiate, right, kind of looking at faces. By about 2 years old, most kids, right, start to consistently identify themselves as boys or girls. And around this time, they can kind of consistently label other people, assuming that, right, it's not too ambiguous. So they're using these kind of social cues. This is also when we start to see that kids will start to show more interest in kind of gender type things, right, in terms of certain types of behaviors, clothing, all of that. Where again, younger than 2, we don't really get much difference at all. And so that's kind of our first stage that we generally see. As we progress through early childhood, the next stage that we generally see is referred to as gender stability. And this is the understanding that gender is normally, right, kind of stable from infancy through life, right, as opposed to a role that you can take on and off. And it's not really until around 4 or so, right, sometimes even 5 years old, that kids have a really good grasp of this. And so probably one of the most interesting anecdotes, right, of looking at this is it's not entirely uncommon to have a 3-year-old who fully sees themselves and identifies themselves as a boy, right, see mom doing something, say, hey, mom, when can I wear lipstick? And mom says, oh, well, lipstick's for girls. And he's like, well, when I grow up and I'm a girl, right? Okay, wear lipstick, right? That's very typical for a kid around that age, right? Because they simply don't necessarily understand gender as being a stable thing. But by 4, 5 years old, right, kids normally have that pretty well established. And then we see that this is also around the time when gender becomes, right, more stable in their mind, that they become more rigid. Right, where it's like, well, if this is what I'm going to be, right, then I need to really learn what the rules are of this, right? And so we see a lot of gender rigidity, right? If you've been around a 4 or 5-year-old, you can know that they have very strong ideas about what girls do and about what boys do and whatnot on average. And then as we move into kind of this last stage, gender consistency, we see that kids actually get a little bit more flexible. And that's because in the gender consistency stage, kids come to recognize that superficial changes in appearance don't actually change underlying gender, right? So if I put on, right, a hat and a beard, that doesn't actually magically transform me, right, into a man. And once I understand that, I can loosen up a little bit, right? Because doing something I'm interested in that doesn't perfectly fit with my gender, right, isn't necessarily going to change my gender or things like that, right? And we see that this is a pretty consistent pattern that kids are going through. One thing that's interesting, right? So researchers have been interested in, does this look different for kids, right, who are cisgender versus those who come to eventually identify as transgender. And based on the research that we have so far, the answer is not really, right? We see that they fall into remarkably similar patterns, right? The timing of the pattern seems to be the same. Even the kind of intensity of how much they view themselves as a boy or a girl, how they hold their stereotypes when they become more flexible, all tends to line up just with a different target gender. Right. So at least when it comes to how these things are kind of advancing in early childhood, the biggest, really the only difference that is seen with these kids is that they are less likely to develop gender stability at the same time as other people, right? And say that, hey, because you're born, right, a certain gender, you're going to stay that. And that's probably due to their own experience in the narratives, right, of kind of recognizing like, hey, I was born a boy or a girl, but right, I feel like this, where we do see that that looks a little bit different. But that tends to be really the only difference that is seen there. So when we're looking at, right, kind of this progression and this pattern, there's really kind of two big sort of, ways that people have tried to explain where does gender come from, right? So why did this pattern develop? Well, is it nature? Is it nurture? The kind of classic nature versus nurture debate in many ways have been laid to bed, and that both sides now acknowledge it's going to be both, right? So the idea that it's just one or the other, right, has been pretty readily debunked. But we can see that, right, different theories will put different emphasis on what maybe plays a bigger role, right? So on our nature side, right, evolutionary theories, for example, right, might focus on how the idea that gendered characteristics are kind of evolved mechanisms, right, that over millennia, people adapted because it helped them to in some way meet a reproductive challenge, right? And so to the extent that men and women face different reproductive challenges, they would have evolved different types of cognitive and kind of psychological mechanisms. And so therefore, these kind of gendered characteristics are mostly innate and are going to be kind of mediated by various kind of genetic and hormonal processes. So that would be kind of very typical on that side. We do see, right, for example, that there's some evidence that, say, prenatal hormones, for instance, do have some influence on kids' play interests, right? So for instance, we see that girls who have a particular condition called CAH, they have a kind of unusually high exposure to androgens prenatally, tend to have more boy typical play preferences, right? They do more rough and tumble play, things like that, suggesting that there could be, right, some hormonal influence to some of these things. On the kind of flip side, right, our classic social, our kind of nurture perspective, right, would be, for example, a social learning theory, which is saying that the main way that kids learn gender is going to be through what they're reinforced by, right? So the idea that if I behave in a gender typical way, people praise me. If I don't, they might, discourage me or at least not really give much praise, right? And I can also learn this vicariously through other people, right? So I can see, well, what are other people praised for? Who's cool? Who's not cool, right? All those kind of things, right? With the idea that those kind of external reinforcements are going to reinforce kind of gender stereotypical behavior in kids. And we do see, for instance, that there's some evidence for this perspective. We know that, for instance, when we can go back to rough and tumble play, we tend to see that without realizing in a lot of cases, parents tend to be more rough with their baby boys than girls, right? They throw them up more, they do more motor types of things with them. And that often leads to them being more active in their play, right? So there's probably a hormonal component, right? There's probably also a social component, and these things tend to work together. One of the big issues, though, with really both of these key perspectives is that they tend to do a lot better job of theorizing and generating data regarding gender expression than gender identity, right? So this is all about how I behave. Neither of these are really going into how I see myself. And this reflects a bigger thing, which is the fact that in the literature, we know a lot more about gender expression, right? And various things linked to that and the factors than we do about gender identity. Arguably, the psychological theory that maybe gets the closest to really kind of laying out how our identity might form is a cognitive theory. It's called gender schema theory by Sandra Bem, one of the main cognitive theories of gender development. And it takes a little bit of a different perspective in that cognitive theories see kids as being active agents of their own gender socialization, right? So not necessarily saying that culture doesn't have an influence on them, but what we see is that kids have a strong desire to make sense of their world. Right. And so they tend to organize all this incoming stimuli into kind of categories, which are often called schemas, thus the gender schema. And those schemas then tend to lead their behavior, right? So the idea is that I notice a difference, right? And then I figure out how does that difference apply to me, right? And I use that to organize my own self-concept. And that can develop more kind of stereotyped behavior, as well as more stereotyped ways of viewing ourselves, right? So the idea being, right, and so what gender schema theory is really pointing out is that it's kind of a combination of kids' readiness to make these kind of categories with the fact that we make gender a really visible category in our society, right? And we attach a lot of functional significance to it that is leading this to be such a big identity for kids at a young age. And then essentially the idea is that it's just kind of a self-reinforcing thing, right? So once I label and I notice this and I notice, hey, this is what my gender is supposed to be, that becomes self-prescriptive in a way as I learn how to see myself and how to interact with the world around me. So we can see that in a lot of ways, developmentalists are really saying that, hey, by early childhood, this is when the bulk of the gender development is happening. There is also this kind of like almost tacit acknowledgement that, yeah, something's probably happening in adolescence too, right? But actually, when you dig into literature, there's just a lot less on it, right? So the acknowledgement that gender consolidation, as they call it, right? Maybe that's happening in adolescence as we have kind of this new influx of hormones and new socialization pressures related to gender. But our understanding and kind of theorizing about how that might undevelop or kind of unfold is actually a lot more underdeveloped than when we look at kind of early childhood. So one thing you may have noticed about these kind of major theories of kind of gender development in kids is that they largely just focus on what we'd consider kind of normative cisgender development, right? They're mostly interested in arguing what factors make the biggest difference, right? Is it biology? Is it socialization? Not really concerned with necessarily explaining why somebody who has, right, a kind of discordant gender identity, right, or gender incongruence, where that comes from, right? These theories weren't really designed to do that, and they don't do a fantastic job of it for the most part. And so when we're looking at kind of when sex and gender don't align, and you look in the literature, you'll see that there are a lot of different kind of terms that are commonly thrown around. That to a passive observer would sound remarkably similar, but they actually mean fairly different things and are used in different ways. And so one of the things that people will talk about is this idea of being gender nonconforming. So at its core, gender nonconforming is just talking about when biological sex, right, what you were labeled when you were born, right, does not match up with your gender expression, right? So we see, right, that oftentimes this term, it could be used in either adults or in kids, but it's often used for kids, right? And generally, we're not talking about kids that just have a couple of interests, right, that aren't typical for their gender. That's actually pretty typical, right? That kids, go into any classroom and you're going to find kids that are going to break different kind of gender stereotypes and norms. When we're talking about a gender nonconforming child, we're really talking about a very consistent pattern, right, of preferring, other gender playmates, of preferring the games, toys, clothing that would be generally culturally associated with the other gender, of wanting and desiring to be treated, right, as a member of the other gender, right? So that is really what we're talking about when we're talking about kind of gender nonconforming. This is in contrast to when you hear people say gender incongruent, right, or gender incongruence. And that is really referring more to when sex, that biological sex, does not match up with gender identity, how you see yourself, right? So just because somebody behaves in gender incongruent ways, right, with that kind of gender nonconforming behavior, doesn't necessarily mean that they see themselves as, right, a member of the other gender. It might, right, but it might not, particularly when we're talking about kids. And so gender incongruence is going to be more about the identity. Gender nonconforming is more about the expression. When we see that gender incongruence, right, is leading to clinically significant distress, this is what we refer to as gender dysphoria, right? So it is possible, and there are people who have gender incongruence, but aren't distressed about it, right? It's not impairing their lives in various ways, right? And we would say that that is not a mental condition, right? It's not causing them clinically distress. It's not impairing, right, their day-to-day life. But what we see is that many people with gender incongruence do experience this kind of distress, right? At not being seen the way that they want to, at not being able to function in society in the way that they feel is true to themselves. And so gender dysphoria is going to be referring to that condition in particular. It can become a little tricky because people refer to gender dysphoria just kind of like broadly as being kind of anxiety and distress about your kind of gender and bodily features. But it also refers specifically to a DSM classification. So it depends how you're using it. But both of those are really kind of coming down to whether there's distress or not. And then we'll contrast this to transgender, right? Where transgender, like I mentioned before, is kind of this umbrella term describing individuals whose gender identity differs from the sex or gender that they were assigned at birth. So transgender people, by definition, are going to have gender incongruence, right? So that's how those two are kind of, but you'll see these kind of thrown around in different contexts and in different ways, right? So those are very similar. Not all transgender people have gender dysphoria, but many do, which is why they seek treatment. So those are kind of key things that you'll see that are going to be talked about in the research literature. So just kind of quickly, right, if we look at, right, how, the psychological and psychiatric kind of institutions have dealt with and kind of looked at gender dysphoria over the years. We see, as is true with many things, some evolution, right? So if you look at like the late 1800s, early 1900s, it was pretty widely agreed by medical professionals that people with gender dysphoria were delusional, right? Had right, severe neurotic, psychotic problems, right? And needed to be given a reality check. We see as things evolve, right? We also tend to see that early on, they would just kind of like lump it in with sexual orientation, right? So it's all just kind of together. Eventually, we see that it was kind of pulled out into what was called for a while transsexualism. In an even later version of the DSM, which is the diagnostic manual for mental disorders that psychology and clinical psychology use, we see that it was called gender identity disorder for a while. In the latest version, the DSM-5, right, this was changed to childhood gender dysphoria for kids, or adolescent adult gender dysphoria for adolescents or adults. And the biggest reason for that change was to kind of highlight more that it was the dysphoria, right, that really needed the treatment in particular, right, in terms of being kind of a mental diagnostic condition. So I just gave you an example up here. So this is going to be the diagnostic criteria for kids, and it is somewhat different, right? So basically, we're saying that this has to be going on for at least 6 months, and it has to be manifested by at least 6 of the following. One of them has to be the first one, which is why it's bolded, right? In terms of strong desire to be of the other gender, assistance that one is the other gender. And of course, right, the thing is the condition must be associated with clinically significant distress. So the criteria look a little different if you look at adolescents and adults, and that it's less about like toys and games, right, and things like that, and more about desiring the kids, secondary sex characteristics, say, of the other gender. But the basic kind of premise is the same. So how prevalent is this? This is a hard question to answer in large part because we have really crappy data. We see that relatively few population studies will look at and ask questions about gender identity. The ones that have seem to suggest that in adults, it's maybe about 0.5% in the US, right? So about 0.5%. When you start looking at kids, though, that becomes even more difficult because kids, of course, are not filling out population studies, right? And so where do we get this data from? Some of the best data might be looking at gender nonconformity, right? There's a couple, so the child behavior checklist is a common kind of behavior checklist that's used in a lot of different studies. It includes a couple of items, right, that are kind of about behaving like the other gender, wishing to be the other gender. And based on that, we can see that nonconformity, depending on your sample, about 1 to 3% of boys, 2 to 5% of girls. But again, remember, nonconformity does not necessarily mean, right, having a transgender identity. If we're looking at actual dysphoria in kids, this becomes a lot more difficult to get. Best kind of estimates tend to be taken from kind of extrapolating from gender specialization clinics and a couple of adolescent surveys that were done, suggesting somewhere between 0.6 and 1.7 at the high end, depending on how we define some of these different constructs. But again, taking those data with a grain of salt, in that it's very difficult to get good, reliable data on this population, particularly when it becomes politically kind of charged. One of the big questions is, has this increased over time, right? Is this something that is more common now than before? And given that we don't have good data on how prevalent it is in general, you can imagine it's also very difficult to be able to confirm this. What we do know is that there has been an increase in referrals over time. So that is something that can be easily tracked, right, by gender clinics, and that we have seen some changing demographics in the referrals that are made. So this is just an example. So this is from a kind of gender clinic in Britain, but we actually see very, very similar patterns when you look across other countries and other clinics. And basically we see a couple of trends that are going on. One trend is that we are getting a pretty rapid increase in the number of adolescent referrals relative to children. So children have gone up a little bit over time, right, as kind of things have gained more attention, but really not that much, whereas adolescents have jumped up pretty significantly. We see that if you were to go back before this chart even begins, like before 2010, it was actually more children than adolescents on average being referred to gender clinics, right? And so that has definitely kind of shifted. We also see some sex differences, right? So when we're looking at kind of natal sex, right? So the sex assigned at birth, we see that historically, there used to be the biggest difference in kids, right? So boys, right, natal boys are much more likely to be referred to clinics than natal girls, even though girls are actually more gender nonconforming, probably in large part because we have a lot more tolerance, right, for masculine girls than we do for feminine boys in our society. So people look at gender nonconforming behavior and be like, oh, geez, we need to go do something about that more quickly in boys than in girls. That has changed a little bit over time, right, where we get a decrease in that. So it's a little closer in terms of kind of the sex ratio for kids. In adolescents, it used to be pretty close 1-to-1, right? So about as many boys as adolescent girls, right, are kind of when we're talking about kind of natal gender, were referred to clinics. And what we see here is, although both boys and girls are increasing, we get a much more dramatic rise for girls, right? So adolescent natal girls, we tend to see the biggest kind of jump in referrals. There's a lot of debate about what this does or does not reflect. At the end of the day, we don't know, right? Honestly, there has not been good research to really be able to show exactly what is driving this. Some people will maintain that it's the fact that now that we have, right, more access to the social media, internet, things like that, people have a name for the way they feel. Right? They can now label and identify and say, hey, this is how I feel. And oh my gosh, there might be something I can do about it. Right. And thus, maybe it has nothing to do with actual increased rates. It's just about identification. Other people, right, suggest, well, maybe this increase in rate has something to do with social contagion, right? With other people suggesting these things, right? And other people being like, well, maybe this will solve my problems. Why we see the big jump in girls versus boys is another kind of big area that people don't have fantastic explanations for. So right now, the unsatisfying answer to this is we don't know. We need a lot more research trying to understand what is driving this, because of course that's going to be important, right, in addressing and helping to kind of treat these kids. So just a couple of other quick population characteristics. So what do we know about kids, right, who are identifying as transgender or having gender dysphoria? What we see is in kids, right? So when we're looking at kids with this, we often call this kind of early onset, right? In kids with kind of early onset gender dysphoria, they actually look pretty similar to other kids in the population. They don't tend to have a drastically higher rate of other types of kind of mental disorders, depression, things like that. We see that honestly, the biggest factor just tends to be how accepting, right, their environment is of their gender incongruence. So not surprisingly, right, if everyone's like, oh my gosh, don't do that, right, kids are going to be, right, have more issues. When people are generally pretty accepting of it, we see that they tend to behave pretty similarly to what we'd see in the general population. One interesting exception to this is that we do see an increased prevalence of autism spectrum disorders in kids with gender dysphoria. So the estimates, again, vary pretty widely, anywhere from kind of 6 to some studies show maybe as high as 20% of kids with gender dysphoria have, right, are somewhere on the autism spectrum. Again, it's hard to know exactly where it falls, but even if we take the low end of that, right, that is significantly higher than the incidence in the general population, right, which is about 0.7% of kids. And so this is an area that also needs research, right? There has been, but at this point, lots of speculation, right? So lots of people have lots of theories on why this might be that need to be better researched, right? Probably one of the most prominent theories is that it has to do with kind of the ability for kids with autism spectrum disorder to think flexibly, right? And we see that kids with autism tend to be much more rigid in general. So to the extent that that is applied in some cases to gender, right, it might be very difficult for a kid that does not fit well within gender norms, right, to be able to deal with that, right? And so maybe we see more gender dysphoria. It's a theory, right? But we do see that this is something that's been showed in multiple studies and tends to be a pretty persistent kind of characteristic that's associated. When we get to adolescents, things get a little dicier. So when we look at adolescents who are being referred for gender dysphoria, right, with this kind of later onset, we do see a much higher rate of kind of psychological comorbidity, right? So about 40 to 45% of adolescents in kind of the US and most countries in Europe, right, who are being referred for gender, right, kind of issues, oftentimes will have some other serious comorbidity. Things like depression and anxiety tend to be the most common. We also see higher rates of things like self-harm, of suicidal ideation, all of that. We see that it is influenced to some extent by how supportive their families is, but actually less so than for the younger kids, right? So for the younger kids, that seems to make all the difference, right? It makes some difference in adolescence, right? But we see that even with supportive families, a lot of those things will sometimes still be prevalent. And we get into a lot more social issues, right? In terms of the likelihood of being bullied, of being in fights, right? Of fearing for their personal safety, things like that in a way that we don't generally see with our younger kids who are going to be kind of gender incongruent. So where does this come from, right? What is the etiology or cause of this? At the end of the day, as with many things we've been saying here, we don't really fully know, right? Most research, right, kind of suggests that gender identity is probably, right, kind of developed through a kind of complex interaction of biological, environmental, cultural factors. But, right, in terms of really being able to identify exactly where gender incongruence come from, why does it develop in some people and not others? That's a big question mark. We see that we've got kind of people looking at trying to identify perhaps biological factors, and there is some evidence, right, that biology may play a role here. This is, the research has generally looked at things like genetics, prenatal hormones, looking at kind of neurobiology, so brain structures, things like that. If you look at genetics, for instance, we see that if you compare, right, if you look at twin studies and compare identical twins who share 100% of their DNA to fraternal twins who share, only 50%, concordance, right, so having the same gender identity in terms of being transgender is about 40% in identical twins. It's pretty close to 0 in fraternal twins, suggesting there's something going on there. That said, 60% of identical twins, right? If you take the flip side of that, right, don't have the same gender identity when one is transgender. So it suggests there's something there, but it's probably not a full story. Similarly, when we look at prenatal hormones, they seem to play some role, but it's definitely not fully explaining, right? So if you look at girls who have, again, exposure to unusually high levels of androgen prenatally, they are more likely than the population level to identify as transgender, but over 90% still identify as cisgender, right? So it probably plays some role, but it's not the whole thing. Neurobiology gets really complicated because they're looking for differences in brain structures, right? And they have seen that there are some differences, right, that suggest that perhaps individuals, right, who are transgender have, right, kind of brain structures that are more similar to their identified gender than to their biological sex. But this becomes really tricky because the brain is plastic, right? So we know it changes over time. So is that what caused, right, the kind of gender incongruence, or is that a result of it? So probably plays some role. How big of a role? Not really sure. So does that leave kind of psychological and environmental factors? It's possible, but as of right now, research has done a pretty bad job of being able to identify any particular psychosocial or environmental factor that seems consistently associated, right? So although it's probably some interaction between environment, right, and some of these biological things, as of right now, our knowledge of this is very, very, very nascent. Is that the word I'm looking for? Yes, not well developed. So want to take like the last kind of 20 or so minutes, I think I'm doing okay here, to talk a little bit about kind of trajectories in treatment, right? So one of the big questions, right, particularly in treating kids with gender dysphoria is, how is this going to unfold, right? What happens is a child with gender dysphoria going to eventually kind of, feel different about themselves, right? And perhaps ultimately become a cisgender adult, right? Who doesn't need any treatment, or will the child, right, have an intensifying of their gender dysphoria and ultimately need medical treatment in order, right, to be able to be psychologically healthy. And so this is a very highly contentious, to put it mildly, kind of area of research and topic. What we see is that when you're kind of looking at childhood gender nonconformity and trying to say, hey, does this persist, right? Or does it go away? There are a lot of different ways that we could look at this. But what most research suggests, right, if you look at kind of longitudinal follow-ups, right, is that a majority of gender nonconforming kids do not necessarily end up identifying as transgender later in life. But in all studies, at least some do, right? So where we look at this, so there is kind of a pretty wide range of estimates here, right? If you look at kind of follow-up studies, and this is, when I say follow-up studies, you can count them, right? So this is not a large body of research, right? But from the follow-up studies that we do have, we see estimates ranging from about 60% to 85%, right? Where we would say where they're going to have kind of a remittance of their gender dysphoric feelings as they kind of near and go through puberty. So this 60 to 85% is very, very heavily contested. And the percentage will vary a lot based on who you are studying and what age do you follow up with them and how strong was their gender dysphoria to begin with, right? Were they actually clinically diagnosed versus just had some gender nonconforming behavior? And a lot of these studies just kind of lump them all together. So there are plenty of critiques to being able to really nail down what is the percentage. But even if we do take, right, the lower kind of say 60%, right, and say, okay, maybe 40% are persisting, 60% aren't, that does still suggest that a majority of kids who are behaving in gender nonconforming ways, right, are not necessarily going to go on to identify as transgender. In fact, statistically, right, the most likely outcome is that they will have a non-heterosexual sexual orientation, because we do see that in studies of gender nonconforming kids, about 60 to 80% do identify as lesbian, gay, bisexual when they're in adolescence or adulthood. So we see that this is not a okay, if a kid has gender dysphoria, they're definitely a transgender adult. That said, most transgender adults do locate the beginning of their dysphoria in childhood, right? Not all, right? But majority, right? And we do know that a sizable percentage, at least, right, although less than half, are, right, kind of continuing on this pathway, which leads to the obvious question of, can we predict this in any way, right? Is there a difference between the kids who may look very kind of similar in some ways, right, that are going to persist in kind of having a gender dysphoria, having gender dysphoria, having transgender identity, versus those who might have a lessening of that experience? We see that this is an area that there's slowly growing more research in. As of right now, the best predictors seem to be the intensity of the dysphoria and the amount of cross-gender behavior that we see, right? So kids who are engaging in more cross-gender behavior, right, who have very intense dysphoria are more likely, right, to persist in that than kids who may have a lesser degree. Now, is there a clinical cutoff for this? No. Right. So this is where it becomes, there's not an agreed upon, like, this is how much, right, or anything like that. It's just a general trend that is seen. There's been a handful of other things, right? So whether it's kind of the sex assigned at birth, right? So somewhat higher persistence in natal girls, age at assessment, whether they socially transitioned in childhood, particularly kind of looking at natal boys. We see one interesting thing is there's some qualitative research that shows that even the way that kids talk about their experience of gender dysphoria may have some predictive value, right? So whether they talk about kind of being the other sex, like this is who I am versus I wish I was this, right? And maybe they wish they were that because, hey, it's easier. I like these things already, right? That seems to be some difference that we can see there. But ultimately, again, there's not necessarily a clear set of kind of criteria that are kind of saying, hey, for any individual kid, this is going to allow us to have this kind of predictive utility. There is some interesting work, largely, again, kind of qualitative work looking at the trajectories of kids, right? So kind of following and looking at kids who, right, have gender dysphoria in childhood and comparing those who persist, right, in that gender dysphoria to those whose gender dysphoria tends to abate. And it tends to show that the period between about 10 and 13 years old seems to be critical, right? That it's during this period where kids are entering puberty that tends to be really kind of central to whether their gender dysphoria is going to get worse, right, intensify, or whether it starts to abate. And a lot of that seems to come down to the actual beginning of development of some of those secondary sex characteristics, of some of the social things that are changing at that time, the emergence of first romantic and sexual interest and how that interacts with other things. That seems to be pretty central. I took a quote from one of the studies because I think it kind of depicts it well, right? This is one of the persisters in the study, right? Kind of saying, as soon as puberty started, I could no longer be myself. A boy does not have breasts. As a child, it didn't matter that much. Boys and girls don't differ that, except that boys have a penis and girls don't. But the way I was changing was very wrong. I couldn't hide it anymore, right? So suggesting that really that area at the cusp of puberty and early puberty, right, might be really key to seeing what those trajectories are going to look like. And this actually ties in directly to the kind of general recommendations for treating childhood gender dysphoria. There are, of course, debates about kind of specifics, but there's actually a decent amount of general agreement, right, among kind of medical and psychological professionals that care for children, prepubescent kids, right, with gender dysphoria should largely focus on counseling, right, helping them deal with their feelings of gender dysphoria and helping those to feel better, right, dealing with any other psychosocial or psychological difficulties, optimizing their own kind of well-being and adjustment. And that they should not, right, involve any kind of medical intervention before puberty. Also, right, that they should not necessarily be aimed at trying to avoid, right, same-sex attraction or gender identity later on, because there's really no evidence that you can do that anyhow. And so we see that it tends to be really very much focused on how do we support the kid, right, help them to flourish in the place where they are and give them the space for their gender identity to develop as it's going to develop, right? And not until we're really hitting puberty, right, would we move into any other types of treatments. And that's where things get really messy because here's where you get the very, very contentious debates. So if you're looking at what are kind of the most commonly used guidelines for treating kind of children and adolescents with gender dysphoria, what we see is that it's going to be the guidelines. So the Endocrine Society, as well as the World Professional Association for Transgender Health, have put out kind of sets of guidelines that are the most commonly used. They are going to very closely follow what has been kind of so-called the Dutch model of treatment, right? That was created at one of the more prominent clinics in Amsterdam, and has been kind of the most researched model of treatment. And essentially, right, what the Dutch model is going to say is there are different approaches for a kid who's under 12 and for kids that are 12 and older, right? So kids under 12 is exactly like what I just talked about a moment ago, right? You're providing counseling, particularly family supports, because what we see is it oftentimes causes more turmoil in the parents, right, than in the kid even, right? So a lot of those kind of levels of support. Once you're looking at a kid who is 12 or older, right, then we see that you might kind of start with psychological assessment, and assuming that we see that the gender dysphoria intensified with puberty, right? If a kid is at least 12 years old, right, and is at least at a minimum of what there's Tanner stages of puberty, you don't necessarily need to know all the details there, but they basically have to be, if they're a boy at stage 2 of puberty, a girl at between 2 and 3 of puberty, right, means that they have started that process. And if both of those conditions are met and they are showing severe kind of dysphoria about the development of their secondary sex characteristics as this has started, right, then it might be recommended that they have puberty suppression. So this is largely considered to be a mostly reversible thing, right, in that essentially you're just kind of pausing puberty. You are pausing the continued development of those secondary sex characteristics, in large part to kind of lower the distress of the child. And the idea is perhaps give them more time, right, to figure out, make sure, hey, is this continuing to persist, whatever else. Assuming that those feelings then persisted, the Dutch model would say that at around 16, you could start to implement kind of gender affirming or cross-sex hormones, right? And here's where we start to get into things that are more irreversible, which is a large part why it's not going to be until later in adolescence that it's recommended that you would do this. And then you can see kind of 18 plus is when most of the guidelines would say any kind of surgical intervention, right? So really once we're reaching adulthood. There are some people that will argue, hey, maybe a kid in older adolescence, right, when you're talking about like mastectomy or things like that. Not really going to get into that though, just because that's not generally really what most of the guidelines are recommending. It's really going to be these kind of first 3 when we're talking about childhood and adolescence, right, which is topic of what we're kind of covering here. So in terms of kind of when you're looking at the whole process, the Dutch protocol and other adopting clinics, right, are going to have ongoing supportive therapy be a very big part of this, right? So not only do you need extensive therapy and evaluations prior to make sure you're eligible for this, right? But this is a continuing thing, right? To help address any existing comorbidities, right? Some depression is caused by being transgender, but not all depression is, right? And so how do we deal with various things that might not actually be due to transgender identity itself? Helping adolescents prepare for, right, changes that their body might go through as part of these treatments, know what they should expect and what they shouldn't expect, right? Have realistic expectations for the outcomes, all of that. A lot of this will also involve kind of various forms of family therapy, like I said. And of course, you can do a variety of other kind of non-medical interventions in terms of, right, kind of changing name, doing things to kind of socially be acknowledged, in-person and online kind of support groups, right? All these types of things, voice and communication therapy, things that are non-medical, but might help to reduce that dysphoria some as we go through this process. So when we're looking at kind of pubertal suppression, essentially really what we're doing here is we are using some sort of kind of gonadotropin releasing hormone kind of analog that is going to kind of cut off, right, or suppress puberty temporarily. This is actually something that has been regularly used for kids who have precocious puberty, right? So say an 8-year-old who starts puberty and we're like, no, right? We don't need that to happen yet, right? They kind of use these things and it's been kind of adapted in this context. We see that although research is fairly scarce, The existing data does suggest that there does tend to be kind of in a lot of kids an improvement in psychological functioning associated, right, with the suppression of hormones. We see another key benefit is that there does tend to, this allows kind of better phenotypic resemblance, right? So when you're looking at, if you were to later do cross-sex hormone therapy, right, you're going to have a much more kind of realistic, quote unquote, right, but looking at kind of body. If I want to look like a female, I want to look like a male, if we have not let those secondary sex characteristics fully develop. And so we see that for individuals who just want to pass in society, right, and don't want to stick out, right, don't want to do something, right, that this can provide much better results down the road. And we do see that better passing in adulthood for a lot of people is associated with better psychosocial well-being, right, because they can just kind of live their lives. And it can, in some cases, minimize the need for later surgery, right? So if I am a transgender woman, right, or a transgender man, and I prevent my breasts from developing, right, I do not need to later have surgery, right, to remove them. And so we can see that there are some real benefits here, but that's not to say that there aren't any risks, right? We do see that although it is a largely reversible thing, right, you can stop taking them and puberty will start back up. There are still some effects from this. There has been research on the potential for reduction in bone mineral density because we know that a lot is happening with our bones during puberty. There are, right, people have raised the possibility of the potential impacts on brain development. There's a little bit of research that suggests that they haven't really seen a big difference, right, in say executive functioning skills or prefrontal cortex development in kids who are taking puberty blockers versus those who don't, but not a highly researched area yet. There are some consequences of genital underdevelopment for fertility. So if you have not, right, kind of progressed beyond the very beginning stages of puberty, right, then you will not actually have functional whether it be eggs, right, or sperm. And so if you wanted to preserve fertility in some way, right, could cause issues later on. There isn't a lot of good long-term medical safety data in the sense that most of the data that we have is coming from kids who had precocious puberty. In most cases, right, you're only going to need to suppress puberty for a couple of years before they're at least within the range of what would be halfway typical for kids to be going through. We don't know a lot about what happens when we suppress puberty for longer. And particularly as kids, especially girls, hit puberty earlier, right? The period between when we would need to suppress puberty to get optimal effects from the therapy, right, and when we might feel comfortable beginning cross-sex hormones gets bigger, right? And so it introduces just some different dilemmas, right? It's not a 100% straightforward, this is the best idea for everybody kind of thing, because there's a lot of different factors that are involved. So when looking at kind of the cross-gender hormone therapy, right, again, so this is going to be used to actually promote the secondary sexual characteristic development. So whether that be the development of breasts, redistributing fat and muscle, right, to have, right, kind of more kind of typical appearance, going to influence facial hair, all that kind of stuff. We see that when we start to get into cross-gender therapy, we do start to get more irreversible effects, right? And so we see that the impact on fertility, right, can be irreversible at this point. And historically, right, that's a big reason why it has not been recommended, right, to really do these types of things until 16. And even then has to be with parental consent. Of course, there's a controversy. How old does a kid need to be, right, to be able to make decisions about their future fertility, about their gender identity, things like that, right? Is it 15? Is it 16? Is it 25? Right? I mean, we can look at a lot of different kind of things here. And so a lot of the controversy around this, right, is due to this kind of potential gap between a child's physical maturity, right, and their psychological, emotional maturity, right? And how do we optimize both of those, right, when we're kind of dealing with things? So, sorry, we'll have some time for questions. Look at it, just a couple more slides. When we're looking at kind of the question, right? So the debate over should we, or, you know, should kids have access to right, transgender kids have access to gender affirming therapies? And if so, when? Oftentimes, the debate is coming back to this idea of harm, right? What people differ in is where the most harm is, right? So is the most harm done perhaps by actually doing these therapies or by not doing them, right? Which is worse, which is potentially the most kind of damaging to kids as they get older. And what we see is that this is something where you think, well, let's just go to the research and see what it says. But fascinatingly, right, depending on what subset of articles you read, you could come away with very different conclusions on whether this is an extremely well-supported therapy protocol, right, that has excellent results, or this is a completely unsupported, right, kind of thing with no scientific basis. And so obviously both of those cannot practically be true. And so when it comes down to it, there's a couple of key issues here. And the big one that's leading to a lot of this debate is that there just isn't that much data, right? So the data from kind of what we call outcome studies, right? So studies that are looking at kids who have gone through, right, various treatments and what their outcomes are. There's only so many of them. And in general, the data tend to be kind of what we call low quality, at least based on evidence-based medical standards, right? So in medicine, right, the gold standard is using controlled trials, right, where we are randomly assigning people into, right, different groups. We've got a treatment group, we've got a non-treatment group, we follow them. That research just does not exist, right? There is not that research that has not been done on transgender interventions in general, let alone for children and youth. And people very vigorously debate whether such a thing would be ethical or feasible to do, right? Could you even assign people to these conditions, right? But at the end of the day, right, we don't have that kind of data. And there's really only, most of the support that we have is coming from a handful of kind of short-term or medium-term follow-up studies. That said, when you look at those follow-up studies, most of them, right, are done, right? A lot of them have come out of some of the major kind of gender clinics, right? So the one in Amsterdam in particular that kind of developed the Dutch protocol is going to be the most researched and does show some promising outcomes, right? In sense of having kind of reduced depression and other kind of psychological issues, better functioning, better esteem, reduced kind of suicidal ideation, all these types of things do tend to be associated with this. Where the problem is that we just don't know how generalizable that data is. So one of the critiques that have been made sometimes of the base and why you can get people that are arguing like that this is telling us two entirely different things, right, is that a lot of this data was done, right, coming out of particular clinics or ones that use very similar models. Does it apply, right, to places that aren't using that model? We see that a lot of the research has focused just on kids with early onset dysphoria, right, who have what is sometimes called kind of complete cross-sex identification, meaning that I am a biological boy, identify as a girl, doesn't include people who are going to be more non-binary, right, in terms of not necessarily saying, hey, I want to be a woman, right, or I want to be a man. We don't have a lot of research on that. And most of these kids, right, they were screened to have a pretty good layer of parental support coming into the study, as well as decent psychological well-being, right? So they've had, you know, an essential component of having other comorbidities kind of dealt with to be able to get this treatment. But what we see, of course, is that if you look at where the prevalence is really going up in the incidence of kind of transgender, a lot of this group, right, so adolescent onset, right, who have higher comorbidities, who may be more likely to have non-binary identifications, this research might apply to them, right? So it's not to say that it does not have benefits, right? But we just don't fully know, right? And I think that's where the debate comes from, right? Is that you've got one side looking at the promising evidence that we do say and saying, hey, let's do this, right? And the other side saying, we have no evidence, let's not do it. But at the end of the day, right, neither choice is value neutral, right? We can't just say, hey, we'll wait till we have more research and long-term outcome data and won't do any treatments on anyone until that point, right? That's not a neutral option either, right? And so what it comes down to in a lot of ways is just, what do we pay more attention to? People who are proponents of gender affirmative care tend to focus more on what we might call false negatives, right? Of trying to avoid not treating people who would benefit from it, right? And might be harmed without it. People who are going to be kind of critics of the perspective are going to focus on more what we call false positives, right? So they're more concerned with avoiding medically treating somebody who might not need that actual treatment and could be harmed by it, right? So again, it's back to the harm. Who are we harming? Where's more harm being done? We do know that there are people who do what they sometimes will call detransition, who maybe go through medical transition and then detransition later. We don't know a lot about that group, right? We know there are some people, right? There are anecdotes of this. There's a tiny bit of research, but how common these false positives are and whether we can differentiate them is another big area, right? So I know I did not exactly stop when I said I was going to, but I think if we're talking about where do we need to go from here, right? I think there is not a simple answer here, right? As you can see, this is a highly complex field. I think there's a couple things that become obvious. One of them is we need to complicate the narrative, right? And we need to depoliticize it, right? Because it's not nearly as simple as either right or left kind of talking points, right, would make it out to be. There's a lot more in there that if we don't dive into it, we're not going to be really doing the best that we can for kids and adolescents. We need well-funded, high-quality research, right? If there's no other theme that has come through in this talk, it's that there's just a lot of unanswered questions, a lot of things that we don't know, and we need more research on these things, and we need it now, right? And it needs to be well-funded. And what we see is the more political this becomes, the more that actually becomes difficult to do, right? And so these things are working against each other. And ultimately, we need to take the results of this research that needs to be done, right? And we need to use it to be able to kind of create standardized evidence-based treatment protocols, right, that are consistently used so that we make sure kids are always receiving, right, at least what is currently the best evidence kind of based medicine that we have. Thank you. All right, so I think we have some time for questions at least.
A basic question is kind of a chicken or egg thing when you talk about the adolescent comorbidity. Do they have the comorbidities prior to having causing the dysphoria, or because their family structure wasn't supportive, et cetera, et cetera? I don't know.
Yeah, I mean, I think your inclination here is right on. It's hard to untangle, right? Particularly, so to really be able to know this for sure, we'd have to track kids who had not yet developed any gender dysphoria and see if they already had comorbidities before that dysphoria, and then what happens afterwards. It's probably both, right? We do have evidence that kids who have gender dysphoria, and particularly if they're not being well supported for that, right, have much higher depressive symptoms. So there is likely going to be some causal thing there. But it's also possible, right, that perhaps people who have other, right, types of things going on also have gender dysphoria, right? So whether that causes them to have the gender dysphoria, I don't know that we have any evidence for that. But even if you just look, I mean, look at general adolescent mental health, right? Just in the general population, we have high rates of depression, anxiety, all these things. So it would be surprising, right, if those things weren't comorbid with some people who also have, right, transgender identity, even if they weren't remotely connected to each other in any way, right? But there may be, right, some connection there too. Yeah.
Dr. Bredow, I think the thing that was most interesting to me about your talk was when you talked about trying to assess harm. So if you could go back about 8 slides, I don't have it.
All right. Which one are we looking for here?
The one that said, if you just let them alone, they will sort of transition out of gender dysphoria at like 50 to 80% or something. That's it. Yeah. Yes. I mean, if you're talking about 60 to 85% of kids sort of get over this, why would you do any intervention that would be probably permanent?
Well, and that's why, so we're talking about gender nonconforming kids here, right? So these are kids who are anywhere from like 3 to 10 years old, right? Who are gender nonconforming, that's where the studies are kind of really looking at. And that is the big reason why there is no treatment that's recommended until they are going into adolescence. And that's largely because it seems to be, like we said, it seems to be something about that adolescent period that we get these trajectories diverging, right? And we can start to be able to tell more, hey, now that I'm getting into adolescence, my body's changing. Maybe I was just more interested in these things and I don't necessarily actually feel right like a boy or like a girl, versus the intensifying. And so that is why, so I'd say that would, is the big reason why we're not like, hey, let's suppress puberty in kids who are transgender before it begins, because there is something considered to be important about actually beginning puberty to be able to make sure, right, that they are, right, going to persist in this identity. Is that?
I said, it says around or after puberty. So my point was maybe even an 18-year-old person might change their mind and say, you know what, I'm really not transgender. It was a phase I went through. I don't know. Seems to be that's pretty compelling data.
Yeah, I mean, I think that probably what most people would point to, right? And I mean, and this is why this is so heavily contested, right? Like, what do we do with this? So when we look at kids, right, who again have an intensifying of, and this is only talking about kids who are starting this early onset, right? That when they have an intensifying of gender dysphoria at around puberty, it does seem like the vast majority of those kids, right, that continues. Does the vast majority mean all? Of course not, right? There are always going to be kind of outliers. And so is it possible that someone at 18, when we talk about people who are detransitioners, right? And that's where we come back to the thing, right? Is more harm done by saying, hey, we know a good chunk of people whose dysphoria intensifies at puberty are going to continue on this. So let's treat them. Or do we say, well, some people might not, so do we not treat anyone, right? And that's where, again, it just depends on which angle you're coming at and what harm you're looking at. Well, so this is not, but this is when we're talking at puberty. So this, you have to distinguish between, and I think this is part of the thing that's so tricky about this data and why it gets used in so many different ways, is that we're talking about kids who have gender nonconforming behavior. 60 to 85% of those kids, right, do not go on, right, to have a transgender identity. But those 60 to 85% of those kids generally are not experiencing the intensifying, right? It's around puberty that it gets better as opposed to worse, right? And so therefore, the real question, I think what you're getting at is of the kids, right, which is not what this data shows us, of the kids who have an intensifying at puberty, right? How many of those kids could potentially in the future, and that we don't have good data on.
Yeah. Yeah.
Yes.
If you want an interesting experience in life, try having two identical twins. One's gay, one's a lesbian. And we also have friends that have the same experience. And luckily enough for our gay twin, she came out as a senior at Hope College, and Kristen Gray really helped her through the experience to accept herself, because she was starting to hold in so many negative feelings that we knew something was wrong. And it really helped her to accept herself. And she's really a lot healthier now. And we also have a transgender son that was adopted. And it wasn't until age 40 that he had mastectomy. And he is just the happiest, well-adjusted person in the world now. And so it was a long process for all the kids, but by golly, they've come out on top and they are just fine.
Yeah, thank you for sharing that.
I think this is the slide that got to me also. Oh, hold it closer. This was a slide that got to me also because we have a number of family members. I think everybody has a number of family members or friends who are gay, and they are feeling kind of confused or somewhat discomfort because they're wondering, is every kid who is like them, when as a small child who maybe if they were a girl, they wanted to be play boys sports, or they wanted to, they had those tendencies to dress however they, but they grew up to be gay. Are those all going to be now told they're trans? How do we sort that out? So I mean, I think our society's just gotten comfortable with gay people, and now we're trying to figure out how to get comfortable with trans people, but we don't, the sorting process is so confusing.
Yeah, I mean, I think when you're looking at, and I think this is actually one of the things, so if I were to dive more into some of the research, right, that was kind of looking at those diverging trajectories, right? Part of what helps kids, right, and why we see that some kids are desisting from some of this is the recognition at the beginning of puberty and adolescence, like, oh, I am gay, right? I am lesbian. And then being able to process through, well, maybe, right, I am a woman who's a lesbian, right? And those sort of things that can be difficult to differentiate when you have not had any sexual feelings, right? I mean, when you are 9 years old, it's very difficult. I mean, people can debate when you might have any inclinations there, but for the most part, right, people aren't going to really be confident in what their sexual orientation is until they have had some sort of sexual attraction, things like that. And so we see that, again, does that suggest, I mean, really, what it suggests is that among gender nonconforming kids, right? And again, this is not just I have a few interests, right? Or I'm a tomboy, right? But like these are very consistent, right? Kids who are very consistently wanting to be treated like the opposite sex, doing all those types of things, right? We do see that a decent number, right, will go on to identify as non-heterosexual. Not all, right? I mean, it's 60 to 80%, depending on your study, but a majority, right? So that is a plausible outcome, right? And some of them, right, may also ultimately end up identifying as transgender. And there's some overlap in those groups. But I think really where a lot of the focus is trying to push right now is how do we give kids who are questioning their gender identity space, right? Particularly when they're prepubescent kids, right? How do we give them space to not feel like they have to choose anything right now, right? That they can just kind of live out, right, what feels natural and comfortable to them, right? Without having a foregone conclusion, right? Of like, oh, if I'm doing this, and this means I'm transgender, this means I'm gay, right? Before realistically, they might be able to possibly know that. And I think people are trying to kind of say, hey, this is the big thing, right? But we get lost in all the weeds in terms of, right, is the kid going to be this or that, right? When honestly, with a 5-year-old, maybe, right? But you're going to need to give it a little time. Yeah.
You did a little research on.
There's 2 mics.
There is. In unison though. You did a little research on twins, and I have a transgender nephew who's a fraternal twin, not identical. Is that unusual? I've learned a lot just sitting down talking with him, but I thought your research said that's very unusual and it's more common in identical twins.
So it's not that transgender identity is more common. What we see is we're looking at, so what we're interested in is trying to figure out, do genetics play a role?
Yeah.
One of the most key ways we do that is using twin studies, right? Because we know identical twins, 100% of their genes are shared. Fraternal twins, maybe very similar upbringings, right? But only 50% of their genes. And what we see is in fraternal twins, there's no real concordance in gender identity, in the sense that when there's one transgender twin, the other one on average is no more likely than anyone else in the population, right, to be transgender. When we look at identical twins, it's about a 40% probability, right? So by no means 100%, but higher, suggesting some genetic contribution. But that's just about whether they are going to both have the same gender identity, not whether they're going to have a transgender identity, if that makes sense. Yeah. Yes.
I really just wanted to make a comment related to the discussion about how do we know, and what happens if certain outcomes occur. I think that's what makes some of the legislation problematic, in that the result is that the kids don't get care, right? So there isn't anybody to help families figure that out and help the children figure that out. So that the outcome of some of the legislation is that these clinics close. And then you don't have anybody who is a specialist in this area to help a child work through those questions so they can determine what direction they want to go. Kids are pretty smart, right? But they need help in this very complex area. So I think that's one of the sort of takeaways from me in looking at this data, is that it's just really important that families have access to the care. And then the families and their physicians and specialists can figure out what the best course of action is.
Yeah, absolutely. And I mean, I would say that's where the politicization of it becomes so problematic, right? And again, this was not a political issue like 5 years ago. No one's even talking about this, right? And so, yeah, the more that we make it political, the more things are being done, right, that are not necessarily going to benefit kids, right? And part of that being, if you just take away any gender access, right, access to gender, that is not actually going to solve all the problems, right? It could possibly, I mean, and I think here's where the false positive versus false negative. So if we say nobody can get gender affirming care, right? Is it possible that some child who maybe would have desisted, not felt gender dysphoric anymore, might not get treatment and could benefit? Yes, right? But how many kids on the flip side, right, who really needed that aren't getting it, right? And so that's why we're talking about, both sides are talking about harm. They're using the same word, right? But they're referring to harm for different people and kind of how we weigh that.
This might be off topic a little and might require more time than a minute, but I'm just curious how young people referring to themselves as they relates to all of this.
Yeah. So, I mean, when we're looking at, and I didn't really dive into it in part because I already went way too long with things, but also, right, so that would be when people are referring to themselves as kind of non-binary, right? And really what that means is they don't feel comfortable, right, referring to themselves as a man, referring to themselves as a woman, but they don't necessarily have what we consider that kind of complete cross-sex identification where I'm like, but I am a man, right, or I am a woman. That is what most of the research has been on, is that complete cross-sex identification, right? That's what most of the treatment protocols have been developed around. We know a lot less, right, about when people are identifying as more non-binary, right? In terms of what is the best treatment, all of that. In a lot of cases, right, sometimes, you know, what you might see is more of the, hey, well, perhaps you don't want a body of a man or a body of a woman, right? But you just want to be acknowledged socially as not really feeling like you fit within this social category, right? And that's where we get, of course, pronouns are different. Different people prefer different pronouns. My personal opinion is that's a pretty low bar, right? Like if somebody, just like if somebody told me, call me this is my name, right? I would be like, sure, okay, even if it was a weird name or I thought it was weird or whatever else, right? I think that, right, to the extent that people are just saying, hey, I just want to be acknowledged as being different than what other people are automatically viewing me as based on what my physical characteristic might be. But that is going to fall more into that non-binary. And that we just really, I mean, if transgender things are under research, when you're looking at non-binary transgender, that is going to be even more the case.
I've got an experience of gender conformity when I was in 5th and 6th grade. When I was in 5th grade, I had a very pretty, beautiful teacher. and then she got married and didn't come back in 6th grade. I was very sad. Some of my boyfriends were very sad. We couldn't look at her anymore. But obviously, I'm a heterosexual male. No question about that. And it's confirmed by 5th and 6th grade experience.
Yeah, I don't know if that would be gender nonconformity so much as prepubescent boys being interested in teachers, but yes.
Well,
Questions here on the chat.
oh, okay, go ahead.
One's already been addressed, but one other is asking, since such a small number of people are actually the people we're talking about, why are people freaking out like the world is ending?
Yeah, don't know if I fully have a good answer to that. I mean, I think, here's where we come back to gender wars in general, right? We use gender to organize our world, right? And gender oftentimes is something people have very strong opinions about, right? And so when things are different or changing, right, people do, I think more often, right, it's uncomfortable, right? And so, and I think that's where, again, the same people who are freaking out now probably weren't aware that anything was going on 3 years ago, right? Unless they personally, right, knew people or whatnot, right? And so it's really just a matter of what becomes politically relevant, right? What is becoming culturally, right? And without going off on a whole tangent, right? I mean, we can be afraid of a lot of things. And sometimes we stoke those fears, right, for political gains in ways that may not always be beneficial to really helping the people that are at play.
Are there any other questions online? Okay.
Yeah, so question, where does the term cisgender, like who developed it? I mean, it's actually been, so again, it's one of those words that's used more academically, historically, right? So it goes back way more than 2 years. If you were to look within literature talking about gender development and all those things, it's been a word for a while to describe basically the alignment between biological sex and gender. I think it's only more recently come into more kind of popular vernacular, right, where you hear it used. So it's not that the word has suddenly been invented, but it's something that as we've paid more attention to transgender individuals and those kind of transgender rights, all of that, some of the words have come out of the academic literature and made it into more common usage.
Well, I just want to thank Dr. Bredow so much for, again, coming and speaking to us.
Thank you.